Mob. It's Greta Nance here, and I am with Dr. Fredman. We are super excited for this conversation. This was really honestly driven by you, and we are so excited to be on the cusp of, another new option when it comes to plastic surgery, which is really neat. Obviously, the bus mob community is about all types of plastic surgery now, but we started with a heart for breast implants specifically, and I know that's what drives a lot of people into the community at first. And so every time there's something new or better, it's really exciting to learn from the experts about it. And so, I mean, there's like 120 of you or something like that on here. And I have pages of questions that you guys submitted about Preserve. If you haven't heard about it yet, there's no surprise. It's really new to our country. And I honestly don't know a ton about it either. So I will be learning alongside with you, with honestly one of the only handful of board certified plastic surgeons in the United States who can now offer this. So it is really, really new. And Dr. Fredman, I'm so grateful for, first of all, the time you've taken to go learn about this, because this isn't for everybody, and we're going to learn about that. But and as someone who probably will never be impacted by this, I've already had an augmentation, but I just think it's so cool how technology advances. And, maybe my daughters will, find this an easier method to have surgery than I did. So I think it's really cool to learn about all the new things. So, yeah, without further ado, can you at least give us an overview of are we calling it a Preserve breast augmentation? Is it, I don't even, all I know is the word Preserve.
Yes. So first of all, hello, everyone. Like Greta said, I'm Dr. Rafi Fredman. I'm a board certified plastic surgeon in practice in St. Louis, Missouri. And I am really excited and honored to get to be here and talk to you all about the things that I've been learning and been excited about. So um, like Greta said, I have had the opportunity to learn about some new innovation in the area of plastic surgery, and that's really like what it comes down to. Plastic surgery is a very innovative field. Plastic surgeons have always been innovative. Like a lot of people don't know, plastic surgeons did the first kidney transplant. Like, why were they even doing kidney transplants? Because we're very innovative people. So we always like coming up with new ways of doing things, new techniques, and things like that. And that makes an exciting field. That's part of what I love about it. And this is just a good example of that. I think before explaining like what Preserve is, I think it would be good to say what Preserve is not. Because when you hear about something new and there's a lot of talk about it and what is it and confusion and things, but let me just clear the air with just a few things that Preserve is not, and maybe that'll help, and then we can dive into what is it.
Love it.
So the first thing that Preserve is not a new type of breast implant. I think that's important to know. So
Mhm.
it's not like there's this new implant called Preserve on the market that just got here and do you want to try it or not? It's not. Preserve is a set of tools and techniques and concepts that will allow for a breast augmentation to be done in a little bit of a different way that may be a good fit for certain people. But it uses implants that we already have. It uses the Motiva ergonomic implant, ergonomic 1 in the US. And it's the same implant that we have here that I've been using for over a year. And it's an amazing implant. And this implant is not new to the world. It's been around for about 15 years. It's been in the US for about a year. It has a lot of safety data around it. There's a couple different types of Motiva implants. There's ergonomics and there's a round, but this one uses the ergonomics implant. So Motiva isn't a new implant. It's just a new way of doing, or an adaptation of way of doing a breast augmentation. Another thing that it is not is this is not something that if you are on the path to getting a breast augmentation and you've done all your research and you have your plans and you figured it out, this is not something that you need to be worried is like a whole nother thing that you need to like change your plans and then you need to like find a surgeon that can do this or totally change your whole breast augmentation journey. Breast augmentation is a surgery that plastic surgeons do well and have done well for a very long time. And as you hear about this, you probably will start to feel a little bit of like tension of like, shoot, am I missing out on something? Did I not do all my research? No, you did all your research. You did everything. If your plan is to, if you're getting a breast augmentation in a few weeks and your plan is that you came up with your surgeon is to go under the muscle with a Sientra implant or Motiva implant or whatever, and or you're going subfascial or whatever you're doing, that's the right plan for you. I don't think you should hear this and be like, shoot, I need to change everything. This is just going to bring something to the breast augmentation world that is going to be the right fit for certain people.
Yeah. Well, who and what are those certain people then?
Yeah, so great. So okay, so that gets into like what is Preservé. So I haven't said really what it is yet. So what Preservé is again, it's a set of concepts and tools, actually like physical tools that were developed by Motiva. The company that makes them, that makes Motiva implants, is actually called Establishment Labs. So you'll hear that term. They make Motiva implants and they also make Preservé. And they've been doing this outside the US for a while. It's just now being made available in the US. And a set of tools and concepts and techniques that allows a breast augmentation to be done a little bit differently. And it allows it to be done a little bit differently in a way that a person can have a breast augmentation and it be done without them going to sleep under anesthesia. So it be done with just local anesthesia. It can be done with just a little bit of sedation. That is really exciting and cool option for some people. It may be of no interest to some people, but it may be really, really of interest to some people. It allows for breast augmentation to be done with very minimal recovery because of the way that the surgery is done. So for certain people who have a very active, busy life and are trying to figure out how to fit this into their life, this may be the option for them. And the way that I've been thinking about it, that I think is important for people to think about, is in breast augmentation, there are a lot of options. There's over the muscle, there's under the muscle, there's moderate profile, there's high profile, there's different types of implants. This is just another option. So as people are doing their research and thinking about breast augmentation, now if you are somebody who doesn't want to have anesthesia, or minimal anesthesia, just a little bit of sedation, or again, no anesthesia at all, just local, and you want to have this surgery and be out to dinner that night with your friends and be back at work or doing whatever you want to do the next day and back in the gym at 1 week, and you hear all that and you feel like, well, with that I can now have a breast augmentation, and before that maybe I couldn't really do this realistically. That's what Preservé is for. That's who Preservé is really for those people. And that's why myself and the people that are learning about it are so excited about it, because it is now going to make breast augmentation an option for people who maybe it wasn't an option, maybe in this phase of their life. Maybe 10 years from now it would be, but right now, the amount of people that come to me for a consult and say, I've been wanting implants for like 10 years. I just couldn't fit it to my life and kids and everything. And I wish I had done it sooner. People always say they wish they had done it sooner. Well, this may help people be able to fit into their life when they previously couldn't.
Yeah. Obviously, I love that. Everything continues to get easier, and I think that's really cool. That brings up a ton of questions. The ladies of Bus Mob are super smart. We're all like there because we want to be educated, and we all have a basic understanding of how the procedure is currently done. Then my question is, then how does this technique differ
Sure.
that the recovery would be so much or so significantly shorter?
Yeah. Yeah. So, okay. So now we can get into a little bit of the technique itself and why is it different? How's it different? How does it allow this to be done? So a lot of this comes from the actual Motiva implants. The Motiva implants are very innovative, and they were designed really for this, to really be great for this type of procedure, in that they can safely be placed above the muscle without having to worry about the issues of capsular contracture because of the type of surface that they have called smooth silk. So that's one important thing. They have a very natural look and feel with minimal rippling. So you can put them above the muscle even in people that are thinner, and that is a safe thing to do. And because of the way they made the implant, you can also put the implant through a really small incision and a small little tunnel and use a Keller funnel. People have probably seen implants being squeezed through funnels.
Mm-hmm.
If you try to do that with other implants, it may not work. You may not be able to get it through a really small incision or a small tunnel. So, and a handful of other things that are all around how this implant is designed, and that allows this implant to be placed safely over the muscle and be placed in a way that you actually can preserve. So now we'll get to the word preserve or preserve a person's own breast tissue. So we'll dive into that for a little bit. So the traditional way of a breast augmentation being done, which again is the tried and true way to do a breast augmentation, is you have to make, what I always tell my patients is I need to make the perfect pocket for the implant, the perfect space for the implant. And I tell my patients that in order to do that, I need to be able to see. So I like the incision in the crease under the breast, and I have to cut through some things to make that space. And that's what you do. That's how breast augmentation is done. When you do that, you do end up having to cut through some amount of the breast's own natural support structures. The breast is the anatomy of it is actually pretty complex, and there's a lot of different ligaments and things like that, believe it or not. And you have to cut through some of those things to do the surgery, and that's okay. That's not a bad thing. It's okay, because the implant that you would put in maybe is a little bigger, a little bit wider, and it would fill up that space, and you would do the surgery in a way so that it's not an issue. Because of how you're doing it, usually the person needs to be asleep for it, because you have to do all that cutting and things like that. There are risks with any surgery. You could potentially cut through nerves or things like that and affects sensation, although the risk of that is really low. And that's how breast augmentation is done. Well, if you can take an implant and put it really where you want it to be, in the area that the person is lacking volume and needs volume, which for a lot of people is like up and in the cleavage area, that's where you want fullness. And let's just say you could design a surgery where you could put the implant right there without having to cut through anything. Well, that's pretty neat, because then that implant is going to really stay in that position. You're not going to affect the support structures of the breast. You can actually get by with getting a bigger look with a smaller implant, because you've preserved a lot of the person's own support structures. There's some benefits to having a smaller implant and less risk of the implant falling off to the side over time or bottoming out or things like that. So how are you going to do that? The only way you can do that is with a certain set of tools and techniques, and that's what Establishment Labs Motiva designed. They designed these tools, and that's what Preservé is. It literally is a kit. We have them sitting upstairs in our surgery center, and it's these kits that come with the things that you need to do the surgery in that way. And it's just a way of doing the surgery that allows the implant to be placed exactly where you want, with preserving the breast's own natural structures. And it so happens that you can do that because you're not cutting through things. You can do that without anesthesia or minimal anesthesia. And because you're not cutting through things, and it is a little bit less involved in that sense, it makes recovery a lot quicker.
So, but there's still an incision, obviously. Is it in the same spot? Is it just smaller?
It's a great question. So yeah, there's still an incision. This incision is still in the crease under the breast. Maybe it's a little bit smaller, or maybe not. Honestly, like when you're putting in an implant, especially if it's a smaller implant, the incision is really small. I mean, I personally like whether an incision is 2.5 centimeters or 3 centimeters. Like, these incisions heal really well. I've never had a patient that felt like, oh, if the incision was just a 0.5 centimeter smaller, that would be a big difference. They just heal so well and fade. Even if they're 4 centimeters, they heal really well. So I think no matter how big your incision is in the crease, it's going to heal well, and it's usually hidden in the fold. You can get by with a smaller incision, but yes, you do have to make one little incision in the skin. That's it. But that's the only thing that is cut in the whole surgery. The rest of it is all done with these tools that allow basically the space to be made for an implant. And then it uses a special designed balloon to actually expand the pocket right where you want it, which based on the person's anatomy where that is. A lot of people have most of their breast tissue is kind of down off to the side. You don't necessarily need volume right there. You need volume up in the cleavage area where you want it,
Mm-hmm.
up and in. You use this balloon to expand a space, take the balloon out, and then you put the implant right in. And
Wow.
in doing that, it pushes the person's kind of breast tissue off to the side to maintain everything. You don't cut through any nerves or anything like that. And again, that's what allows people to have this and literally be out to dinner that night with their friends.
Yeah. The benefit of no anesthesia, I know for some people will be huge. Obviously maybe a smaller incision. Again, I think most people are really happy with how their incisions end up regardless. And the just the being awake during it seems like a benefit, but let's talk about just appearance. Because even you saying, well, most people have some tissue at the bottom but less on the top. What if is someone a candidate for this if they're like completely flat? Because I'm like envisioning then an implant up a little too high.
Great question. So yes, someone still is a candidate if they have next to no breast tissue. You just would choose potentially a different implant width type, and you would place that implant in a bit of a different location. And that's one of the when the surgeons, as the surgeons have learned, myself included, have learned about the surgery, there's a lot of excitement around the different things you can do with it. You can put it here, you can put it there, you can put it exactly where you want.
Hmm.
And because those support structures are there, I would have a lot of confidence that it's going to stay in that area. So in someone that has very little breast tissue at all, you would want to put it more centrally
Got it.
and choose an
If
implant that's going to be the right width.
sticking with the aesthetic piece of it, if you had a person who maybe got 300 cc's over the muscle over here with a regular breast augmentation, Motiva implants even, and 300 using the Preserve, very similar anatomy, is there any different, like, is there any aesthetic difference why I would choose one over the other? If I didn't care about the anesthesia or some of the other things, does this look better?
Yeah, great question. I think it would be hard to say that it looks better because regular breast augmentations look amazing. Like, and that
Mm,
goes to the same thing. You shouldn't be listening to this and being like, oh man, I gotta do Preserve to have a better look. Preserve is great for people that want smaller implants. The largest implant that you can use with Preserve is 315.
okay,
So
I
that's
was
the
gonna ask that.
315 cc's is the largest. Now, people will say that a 315 and a Preserve maybe looks a little more like something in the 400s with a traditional because you're preserving more of that tissue. And I think there's some
Mm-hmm.
truth behind that. So you might be able to get by with a smaller implant and get a little bit of a bigger look. So if you were hoping for something a little bigger than that, that shouldn't mean that you can't do it. You may still be able to. But overall, the end result is going to be similar because the end result from a breast augmentation is great.
Mm-hmm.
And these implants are great. And you can have these implants put in over the muscle without Preserve, and you're going to look great.
Mm-hmm.
So I don't think that the reason to do it is because it's going to look better, because it's hard to get better than like really great, anyways.
Mm-hmm. No, that makes perfect sense. Let me ask you about recovery, especially because I'm hung up on the pocket is still created. And so every surgeon has a different, recommendation for recovery. I know what yours is at Amelia. And with working out, it's usually kind of 6 weeks till you can really get back to heavy lifting. Most people take a few days off with a regular breast augmentation. But if you're still using this balloon to create a pocket, do I not need the same? How come I don't need the same? Time
Yeah,
off the gym, which is very intriguing. I wonder if more people will choose Preserve because of that than honestly even the lack of anesthesia, because
for sure.
that's a nice feature.
For sure. I have a patient that is going to be getting her Preserve breast augmentation, and she's a good example of somebody who I had to tell her about it because literally she was somebody who's active duty in the military, needs to get back within 2 weeks to doing push-ups, and is also afraid of anesthesia, all the things. I was
Mm-hmm.
like, this is the right surgery for you
Mm-hmm.
because you can go back to that. I tell my patients with Preserve 1 week they can go back to doing exercise. And why? So to your question as far as why.
Mm-hmm.
So some of it has to do with the lack of cutting. One of
Mm-hmm.
the reasons, and it gets into why do we restrict people in their exercise and
Mm-hmm.
activity after surgery. One of the things that surgeons are worried about and are thinking about when someone's recovering is if some of the blood vessels and things that are cut during the surgery, if you put too much pressure behind them, you might have a bleeding problem.
Mhm.
So in this surgery, because those vessels aren't cut, they're just pushed
Hmm.
off to the side in kind of a tight space. There's far less concern for that. So that's why I feel comfortable with people getting their heart rate up sooner,
Mhm.
which is nice. The other side of it, with the implant being over the muscle, you don't have to worry about the muscle putting pressure on that pocket while it's still being formed. A lot of my patients still get implants under the muscle, but in that case, I do want them to wait 6 weeks before doing chest exercise, because exercise will put a little bit of tension on the pocket, and it might cause them to
Mhm.
heal a little bit more to the side. Well, benefit of implants being over the muscle is that you don't have to worry about that. So those
Mhm.
are kind of the main reasons why. There's a few other technical things, as far as it is a little bit of a tighter space. You probably don't have to worry about things as much.
Mhm.
Um, but those are the main reasons why. So for me, it's 1 week until back to regular activity.
Someone just messaged me earlier today and asked me if the recovery for Preserve kind of eliminates the drop and fluff period too. Like and I was like, maybe just because it's over the muscle, it's better, but I don't know.
Yeah. So the early results from Preserve do look very good. I think a big part of it is over the muscle.
Mhm.
Um, the cases that I've done, and ones that I've seen too, that the early results definitely don't have that same drop and fluff process, but there's still swelling.
Mhm.
There's still change that's going to happen. So there always is some amount of that, but it's not going to
Mhm.
be the same as if someone gets implants under the muscle. That's definitely true.
Mhm. That's really cool. I think people will enjoy that too. Um, Over the muscle always brings up, I know we have talked even a little bit about these new implants having a much lower risk for capsular contracture going over the muscle, which as an over the muscle girly, I'm more excited to be able to tell people that this is a safer option for you. I mean, safe, a less chance that you have to go have something revised. But does this method or these implants, is there anything different with the warranty, with the longevity of your results, or anything like that that's better or worse?
Yeah, great question. So um, the simple answer is no, there's no difference. It's the same implant, it's the same warranty. It's just a different technique with some different tools. And thinking about it, it would be not really any different than if if a group of surgeons, innovative surgeons, got together and said, we're gonna, when we do breast augmentations, we're gonna like do this on the inside in the pocket instead, because of X or Y. And that's kind of what this is. It is just another way to put an implant over the muscle. It has some potential benefits for some people, but again, it's not. It's the same implant that otherwise you would get. You get the same benefits from it from a longevity standpoint. The concepts are actually that it would help maintain results over a long time because you preserve those structures. There's a term a lot of people, if they haven't heard already, are going to be hearing, which is preservation breast augmentation. There's a lot of surgeons that are
Mm.
throwing around this term. There is some confusion, I think, about what are they referring to when they say I do a preservation breast augmentation. Does that mean they do preserve? Does that mean
Yeah.
and so that's something maybe I can clarify a little bit. It is that over the past year, especially in the US, and this has been going on for much longer than this outside the US. The US tends to be in the breast implant space sometimes a little late to the game because of some of our
Mhm.
regulatory things, which is not a bad thing. It means more research and safety and things. Um, but there's been a concept that's been uh, being talked about a lot and gaining popularity and being done, where to do a breast augmentation where you do preserve more of the natural breast structure. You don't need Preservate to do that. You can still have those concepts, and many of those concepts are just part of a breast augmentation anyways. You want to preserve as much of the person's own structure. You want to preserve nerves. Like, all those things are important. But there are surgeons that are starting to say that they do preservation breast augmentations. It just means that they're using these concepts that they've learned in their breast augmentation. That's great. There's nothing wrong with that. It's a good thing.
Mhm.
Preserve is a type of that, and it's just a way of doing a breast augmentation that also respects those principles.
Mhm. How'd you get included in this? Because I know also, I'm glad you prefaced in the beginning, if you're already on your journey, don't deviate, because this is early, but also you're right about Europe, and it's usually years ahead of us in a lot of ways too. That always makes me feel better that thousands and thousands of other women have already been doing this, and it's like, duh. But yeah, can you tell us a little bit about like how you got involved in this, what
Yeah.
the roadmap does look like? Can we consult about this now? What should women
Yeah.
do?
Yeah, I would love to. So it really started when Motiva came to the US market. So, again, as many people know, Motiva's been in the world for about 15 years, but because of the process of FDA approval and things like that, and how long they require studies to be done before they allow implants to be approved in the US, and only became available in the US about a year ago. And I have no connection to Motiva. I don't work for them. I don't get paid by them. I have literally no connection at all. I use all the different implant brands. They're all good. They have different pros and cons in certain situations. But when Motiva was coming to the US, they sent some surgeons down to Costa Rica to start to learn about these concepts.
Mm,
One of the neat things about Motiva that a lot of people don't know is the family that founded this company is actually a family of plastic surgeons. The father's a plastic surgeon, the brother's a plastic surgeon, and in their R&D facility and manufacturing facility, they even have a surgery center. So their practice exists also
mm,
in this facility. They're doing these surgeries. They're treating patients. They get it in a different way than I think any other company, and that has allowed them to be very innovative.
mhm,
I've said before, we've talked about it before. This is a women's health company that makes breast implants, and I that it really is true.
mhm,
So that is kind of how I initially start to learn about these concepts, and then as they bought Preservate to the U.S., they've chosen a very small group of plastic surgeons to actually help launch this. So we went down to Costa Rica about a month or two ago now,
mhm,
and learned how to do this. And I did Preserve breast augmentation down in Costa Rica, and got to do it myself and really learn about all
mhm,
these techniques. And that's why now you're going to be hearing about just a few plastic surgeons that are doing it. It's going to be available to all board certified plastic surgeons, only board certified plastic surgeons at some point in 2026. We don't know exactly when. But the people doing it now, because of limited inventory from the company, can only do a few of them.
mhm,
So I am now offering Preservate as an option for the right person. But
mhm,
because we can all only do a few of them, we're really being very selective as far as who it is available for. But
mhm,
yes, if you're hearing this and you're like, that's me, that I'm the right person, the process for that now is the same process to have a breast augmentation. You schedule a breast augmentation consult. You can let us know along the way, and we may add you to a Preservate list. But it'll be the same process, and we're going to go through the same thing. We're going to start with your
mhm,
goals, because that's the most important thing, and we're going to understand what are your goals. And then we're going to talk about what is your anatomy and all the things that we do, and see if this is right for you, because maybe it isn't. It may not be
mhm.
right for you, but maybe it is. But yeah, definitely, if you're interested about it, let us know, and we can talk about it.
Let me make sure I've hit the who it's right and who it's definitely not right for too. I know I have some buckets of like, obviously you want a silicone implant. You have to be maybe 315 cc's or less. So you're not looking for, a huge implant. You want ideally maybe to do it awake for some reason. Anesthesia terrifies you, or maybe you've had a bad experience, or you just have a lot of anxiety about it. Your recovery is really important to you. Are there other limiting? Ooh, like what if someone might need a lift? Or is
Yeah,
that like I'm trying to think of like, yeah, the pros and
yeah,
cons for each thing.
yeah. That's a great question. So a lot of people, we do implants and lifts.
Mhm.
So yes, you can get Preservé in a lift. You're not going to be awake for it. So that eliminates
Okay.
that part of it. Like if someone needs a lift, you're going to be under full anesthesia, asleep,
Hmm.
so that I can do what I need to do a lift. So that's going to remove that part. It is also going to affect the recovery a little bit. So then why would
Hmm.
anyone do this if you're getting a lift? It
Yeah.
gets it gets a little bit like surgeons are myself included, are starting to get a little bit nerdy with the applications of this. Like we
Mm-hmm.
find out we have this tool that you can put an implant over the muscle and put it in a very selective place. Wow, we can do some really neat things with that with breast augmentation. So there definitely are people that are doing it with lifts, not because necessarily of the other benefits, but because of the sole benefit of giving potentially a little bit more control over where that implant is and stays. But like I said in the beginning, plastic surgeons are an innovative group of people. So you give them a tool and a technique to do something. Next thing you know, they're going to be like doing things that you didn't even think the tool was made for, and it works, or maybe it
Mhm.
doesn't work. But that's what plastic surgeons do. And if you're hearing this and you're like, well, I don't want to be a guinea pig for
Yeah,
things.
that was my
First of
thought.
all, yeah. So first of all, doing preserving a lift, I haven't done that myself, but that's been done outside the U.S. and people are happy with it. That being said, if you hear this and you're like, I don't want to be the early people to try this, then you shouldn't be. And know that plastic surgeons as a group, we're going to be innovating, and we're going to be doing the right surgery on the right people, and we're going to be sharing how that goes. We're going to be sharing
Mhm.
those results. We're going to be telling you about it. And it may make sense to wait. It may make sense and would be very reasonable to say, like, I'm going to keep my eye on this. This might be the right thing for me, but you should see what it looks like at 1 year and 2 years and 5 years to really know, because
Mhm.
until that happens, you can't know for sure for yourself. So as plastic
Yeah.
surgeons start to push the limit of things, which we always do as a group because we're so innovative, there are going to be some great applications of it, and there are going to be some not great applications of it. So that's a little bit of an extension of what that is.
Yeah, I'm so grateful. Like that's why I love Boss Mob anyway. Not only you guys and the surgeons sharing, but even I think there's two women so far who have self-identified in the Boss Mob community that they have flown to another
Oh,
country and had this,
wow.
and both of them are like, let me tell you, let me share. So I
Yeah.
know that's something the team, the Boss Mob team, they're working on some blog posts just so you can compare. We don't care. It's just cool. Like, give me another choice as a woman, please, because this will be right for a certain subset of people. And yeah, I'm always comfortable being the first one because I know that you guys aren't doing anything that you wouldn't feel comfortable with. But I know for some women, they're going to want to read and see and hear. But yeah, me being in this industry so long too, I've watched so many things do this. I feel it reminds me in some ways of the drainless tummy tuck.
Mhm.
I'm like, that was a big shift of like, who's going to be the
Mhm.
first one to do this? And then it was fine. And now it's weird that we do it the other way.
Right.
But I love that women still can have the choice.
Sure.
That is so cool.
Yeah, and that's what it is. It's a choice, and they're going to be, like you said, there are some people that really like new things
Mhm.
and are going to hear all of this and really want to do it and sign up, and that means it's right for that person. And then there are also going to be a lot of people that hear these things and they're like, not really for me, or maybe not yet,
Mhm.
and that's also right too. The the side of, why should people be considering it potentially now, in terms of, is this, I want to like do something new, an aspect of that I do think is important to share is again, this is not some like, it's not a new implant, it's not like a new breast augmentation, it's just an evolution of something that we already do. We just now have some ways to do it in a different way, maybe do it better. So for the people out there that are skeptical about it, one, you should be skeptical about
Mhm.
everything. It's good to be. But also, if you are seriously considering it, I do want to give you some peace of mind that this isn't like plastic surgeons going, coming up with some new crazy ideas. This is just a essentially subtle evolution of a way we already do breast augmentation. Um, but again, plastic surgeons get really excited about stuff. So you're going to hear a
Mhm.
lot of excitement about it. And the other part of it is there is a brand around this. Like
Mhm.
Preserve is a brand. It's being made by a company. And anytime there's branding around things, I think it should invoke some skepticism. Like,
Mhm.
there's other interests that brands have. We've all seen brands come and go and things like
Mhm.
that. So how do I know I can trust this brand and things like that? So
Mhm.
all those, if you're thinking those things, that's good. You should be thinking those things.
Mhm.
Again, myself and the other surgeons that are doing this and things like that, we're going to share with you how this is going, and I think you should come along for it and follow
Mhm.
along and listen to the stories that we share of patients. Listen to those patients, see their pictures, see how it goes, and then really judge for yourself. That's what I think you should do.
Yeah, I'm dying to be in the OR for one of these first ones too. I just think that would be so cool. Okay, I love being skeptical. I have two more big pieces of this that I am like could go either way. First one being the anesthesia piece. As someone not afraid of anesthesia, and sometimes who has done things awake and I've regretted it, how do you pain manage this? And what does that experience look like? Like, are they literally walking in, walking out the door? Is this like getting filler? Like, do you have to wear a recovery bra afterwards? Like, how is it different?
Yeah. So for most people right now, this is going to be like getting wisdom teeth out in terms of the level of sedation. It's going to, for most
Okay.
people, it's going to be what's called like twilight anesthesia.
Hmm.
People hear the term like MAC anesthesia, meaning there's going to be an anesthesia provider there. And for most people, they will have an IV and they'll be getting something to help them relax. But at the end of the surgery, they're going to be awake and they're going to look down and they're going to see their breasts and they're going to raise their arms up and they're going to be standing up and walking out of here. So like it's not the same as being put totally to sleep. That's gonna be for most people. There are going to be some people that would prefer to be fully awake.
Hmm.
And the levels of fully awake varies a little bit. Sometimes it's fully awake with like a Valium so that you're kind of
Hmm.
chill and hanging out. Some people it's fully awake, fully awake. And of course, the only way to do it and for people to be comfortable is by injecting numbing medicine, of course. So that's a
Hmm.
big part of this technique, actually, is how you comfortably numb up the whole breast so that they don't feel anything.
Hmm.
And there's a lot of finesse there that's important to do
Hmm.
that in the right way to make sure people are comfortable, but it can be done. And that just gives more people options. Again, I
Yeah.
have patients that want to be fully awake and aware of everything, and that is the right thing for them. And I have some patients that are like, I don't want to be totally asleep. That scares me, but I don't really want to be fully aware. And then there's a whole spectrum. And again, there's just more options now.
Yep. And a spectrum of like pain tolerance. This is it for obviously I talked about my Mirena this week, which has brought up thousands of people giving me their opinion. And that's another one. It's like some people are like, no drugs. Other people are like, I don't want to know anything, even at the dentist, And so it is just neat that I wish we had like a poll button want to do this or not. Like I'm really curious how many women will want to take advantage of doing this awake. Um, because it can be such a great experience even when you do go to sleep. And now, necessarily you don't have to be sick afterwards or things like that. So it's really, I think the recovery is going to be a really big piece for people.
Yeah.
The majority of the questions Bus Mob was asking though is about cost. Obviously, you have many things going on here. I'm like, okay, well, it sounds like there's a kit and these, nice newer implants are involved, but also I'm not paying for anesthesia maybe, or maybe I am. And then obviously there are some, surgeons mainly in California, I think, who have posted some of their pricing and it's like 20 grand or something like that. And knowing I think the average cost in the United States is around 8 or 9,000, is that what the price is going to be? Do you think it'll come down? What are you thinking you're about charging?
Yeah. Great question. So this is going to be something that I think will evolve and change over time. Like anything, market starts to decide where things are. I think that it can be hard, I think, to try to take apart what goes into the cost of a breast augmentation to understand what it should cost.
Mhm.
Like it's tempting, I think, to be like, well, if there's no anesthesia, should it be less?
Mhm.
Should it be more? Why is it more if there's no anesthesia? And what does the kit cost? And how does that factor in and things like that? And I think it can be, but how do you factor in the training that's involved and what's involved with that?
Mhm.
So there's a lot of different parts of it. And for that reason, the future cost of it, I don't know exactly where it will land. And I think
Mhm.
the US market will end up telling us kind of where it lands. I can
Mhm.
tell you that in my practice right now, it's a new thing. It's going to cost the same as a breast augmentation. It's so for us, we're charging the same cost that we do for a breast
Oh, that's
augmentation.
cool.
That may change in the future, but I personally would have a hard time telling somebody we have this kind of new thing and thing like that, and now it's
Yeah.
going to cost $10,000 more. So
Yeah.
I feel most comfortable with it. Again, just being another choice. Just like we don't charge more if you're under the muscle or over the muscle, or
Mhm.
sometimes there are things like mesh and things like that increase costs, but um, or different levels of complexity, and of course lifts, things like that. But anyways, for anyone wondering right now, if you're interested in having this with us, it's going to be the same cost that my breast augmentation is.
Thank you for your honesty and transparency about that. I know
Or,
that's awkward, and it is even talking to women about exchanging their implants. And well, why should my exchange cost the same as it did the first time when I've already got a pocket? And it is, we want to understand, it's, you know, like taxes or a car. We're trusting surgeons, but it's so confusing, the pricing, in a lot of ways.
yeah, that's why I wanted to take a little bit of the confusion away from it and just eliminate
Hmm.
that. You don't have to worry about that. Just like many things in the way I practice, it's just about what's best for the patient. What are their goals? What's the best procedure for them? And maybe it's Preservé or maybe it's not, but don't choose it because it's more or less expensive. Um, Choose the right implant, choose the right place to put it, choose the right way to do it for you. And those are only choices you have to think about.
Hmm. That's so cool. Okay, for the ladies of Bus Mob, I think I covered the main topics, but knowing that a lot of women hop in there and it's overwhelming, especially since we're talking about breast augmentation. Liposuction and tummy tucks are one thing, you know, in a lot of ways. I swear, breast augmentation, you have so many choices: over, under, profile, texture, size. Oh my God. And now even the way it's put in. What what's your kind of takeaway if someone is at the early part of their journey? Is this just, maybe I'll mention it in my consultation, or should they wait till March? You know, what's your advice?
Yeah, so I always encourage people to, again, start with where you want to end up. Like, start with your goals. Because if your goals are that, for example, maybe you need a breast reduction and then we're going to do a staged breast augmentation, a year later. So just start with your goals so that you have a clear idea of where you want to end up. That's where I always think people should start. And then you can start from there to think about and research, right, if this is where I want to end up, what kind of things am I going to need to do to get there? Am I going to need an implant? So, okay, so let's say I'm going to need an implant. What do I think about putting it over or under the muscle in terms of how this is going to fit into my
Mhm.
life? Okay, I'm a competitive weightlifter and I do a lot of CrossFit. I want to try to put it over the muscle, or I'm a Pilates instructor. I need to get right back to classes and things. So start to think through those choices. And then I think you'll start to hone in on, all right,
Mhm.
I want an implant and I want it over the muscle. And I don't think I want to go really big. Uh, but I want to be asleep for it because I don't have anything to do with this. Or, okay, so, maybe you don't need to go down the route of preservation and things like that. Or as you go down it, if you feel like I'm really going into this section of like all the things that Preservé is for is what I want, then you should find somebody and talk to somebody that offers that, because there may be more options than somebody that doesn't. So
Mhm.
that's the path that I think. Otherwise, it can just be way too hard if you jump right in and you say, "Do I want over or under the muscle?" Well, there's just too many choices to make.
Yeah. In some ways, me doing it 100 years ago was easy. It was literally, what size saline implant do you want? We're putting it under the
Yeah.
muscle, and here's what the general anesthesia is, and all of this. Now it is overwhelming, but I honestly think I would have been a good candidate for this. And so it's really cool. I'm excited to be able to tell people about it, for sure.
Yeah, and you're right. Like, I have a lot of patients that maybe they're getting an exchange or something, and they had implants put in a while ago, and they'll tell me I didn't make any choices. A surgeon told me that I was getting saline over the muscle, and I didn't even get to be involved in the size. And look at where we are now, where there's different implant brands and types and ways to do it and technologies. And I I know that it can be scary because now there's more choices to make, but that's also what we're here for. I mean, that's what Bus Mob is here for, but that's also what I'm
Mhm.
here for, what you're here for, what we're here for, is to help people with those decisions. You don't have to come in with all the answers. You don't have to come in having decided where your implant's going to go. Do your research, that's important, but we'll help
Mhm.
guide you through it. And it's a good thing to have more choices, because it's just going to make this surgery an option for more people. And that's what excites me the most about it. I think that's what excites
Mhm.
you the most about it.
Mhm.
You and I both share in that we believe in this surgery. We believe in how
Mhm.
it helps women, what it does for people. So if now there's a way that more women can get this done if they want to, then that is a good thing.
Yes, let's move the barriers out of the way. Well, I know you're sharing information with the bus mom community as often as you're getting it, and it's early. I think we've already stay tuned to the busmob.com website blog. I think there's already one blog post up about
Mhm.
it, but I know you'll provide us information as you continue to do these first ones of what you're finding. I'd love to know what people's pain, level is like during it and truly what their first few days are like. That's going to be so neat. But yeah, please keep sharing everything you find with it. I think this is really cool that we can find ways to continue to elevate and educate women when it comes to healthcare and honestly anything. So I'm very grateful for you.
Yeah, and I'm grateful for you and to get to be a part of this community. I feel like it's a responsibility of mine to share this with everyone. As we already have them, but as we have patients that are having the surgery done, I am excited to share with the bus stop community of their experience, and we're gonna collect this experience. We're gonna have them share their experience. We're gonna show videos of things and photos and stuff, and not just
Mhm,
because I'm excited about it, because I think I owe it to the bus smoke community for them to truly understand what this is, because when you see it, it is really cool and it is
mhm.
really neat. I'm so excited for people to see it.
Well, I'm sure most people already follow you on Instagram, but that's my go-to like stalking platform. If you want to watch Dr. Fredman sharing all of the stuff, and especially when he starts doing it, make sure to follow him. It's at dr.fredman.amelia. And we can surely drop that link in here as well. But thank you. Now go home and be with your family. And we'll post all of this to all the places later. So if somebody missed it, they can catch it. But we really appreciate you.
Oh, thank you very much, and thanks for everyone that tuned in.
Bye, everybody.
All right, bye.